This video is brought to you by Global Men's Wellness, your 24/7 AI health expert. No copays, waiting rooms, or awkward conversations. Just real answers whenever you need them. Visit globalmenswellness.com to try it free and get your own on-demand concierge-level wellness expert today.
All right, welcome back, everyone, to the 21st Century Man podcast, where we're going chapter by chapter through this book that's really trying to equip us all for a successful and informed life in the 21st century, right?
Right.
So today we're tackling a pretty big one, and that's chapter 96, Understanding Health Insurance. It's no joke. Like, this is one of those things that can be super intimidating, it's confusing, but it's so important.
It is, especially these days.
Especially these days. And so I'm really looking forward to kind of digging into this chapter and extracting what we really need to know to navigate this complex world.
Yeah, I think this chapter does a great job of breaking it down, actually, kind of right out of the gate. It lays out just how much we're spending as a country on healthcare. Back in 2018, it was a whopping $3.6 trillion.
Wow.
Which is, if you do the math, that's roughly $11,000 per person.
Yeah, that's a lot of money.
Yeah, and it represented about 18% of the entire GDP.
And that's huge.
Huge, yeah.
Compared to, like, way back when, 1960, it was only 5%.
Exactly. So that just shows you how much it's grown.
Yeah. Well, and that's what I was going to say is, like, it makes you wonder, where's all that money going?
Yeah.
And the book doesn't just stop there. It actually goes on to project that by 2028, it could be as high as $6.2 trillion.
Right.
So that would be about, what, $18,000 per person?
Per person, and representing about 20% of the GDP.
That's crazy.
Yeah.
And that's not even taking into account, like, the pandemic.
Yeah, exactly. This was all pre-COVID, so who knows what those numbers look like now.
It's a little scary. But okay, so the book points to a key factor in these rising costs. And it's not surprising, really.
Right.
The aging of the American population. It's just a fact. Right now, about 16% of the U.S. population is over 65.
Yeah.
But by 2030, they're expecting that number to be over 20%. And that's obviously putting a lot of pressure on programs like Medicare and Medicaid.
Right, which are designed for, folks in that age group.
Right, exactly. But these aren't just, abstract numbers we're talking about. These rising costs have some pretty serious consequences for real people, families, individuals.
Absolutely. The book really drives that point home. Medical bills are the #1 cause of consumer debt and financial hardship in the U.S.
Oh, really?
Yeah, it's a big problem. In 2019 alone, over 137 million Americans had trouble paying medical bills.
Wow.
And we're talking about everything from just struggling to make ends meet to facing bankruptcy, even having to dip into their retirement savings.
It's kind of scary to think about.
It is.
I mean, that's why this chapter is so important. The book really emphasizes that investing in your health, and part of that is having good health insurance, is crucial for protecting yourself from those kinds of financial nightmares, right?
Yeah, exactly.
They give these crazy examples, like a 3-day hospital stay could cost you $30,000.
Yeah, and a broken leg, something as common as that, around $7,500.
Yeah, and if you have a chronic condition, we're talking about managing diabetes, heart disease, those costs can add up to hundreds of thousands of dollars over time.
Easily. And it's important to note that marketplace insurance plans can't put yearly or lifetime limits on those essential benefits.
Right.
So that's some peace of mind, at least.
There was this one stat in the book that really kind of blew my mind. Uninsured people end up spending twice as much on health care as those who have insurance.
Yeah, it seems counterintuitive, right?
Totally.
But you have to remember that insurance companies negotiate these big discounts with healthcare providers. So even though you're paying premiums, you're still likely getting care at a much lower overall cost.
Okay, so I'm starting to get it. But then there's this whole thing about the medical loss ratio, or MLR. Can you explain what that is and why it matters?
Sure. So the MLR is basically a way to see how much of your premium money is actually going towards healthcare services and quality improvements.
Okay.
As opposed to, administrative costs, marketing, all that stuff.
So if a company has a high MLR, that's a good thing.
Exactly. It means they're spending more on actual patient care. So, for example, if an insurance company has an MLR of 85%, it means that 85 cents out of every dollar you pay in premiums is going towards taking care of patients and improving the quality of care.
Oh, okay.
And thankfully, the ACA, the Affordable Care Act, sets some minimum standards for the MLR. So insurance companies have to spend a decent chunk of those premiums on actual health care.
And what are those minimums?
So for large group health insurance markets, it's 85%.
Okay.
For individual and small group markets, it's 80%.
Gotcha.
Some states actually have even higher requirements. And importantly, if an insurance company doesn't meet these standards, they might have to give rebates to their customers.
Oh, interesting. So there's some accountability there.
Right.
Okay, so what about the things that actually affect how much we pay for health insurance? Like, what are the factors that determine our premiums?
So there are a few key factors: your age, where you live, your county specifically, whether you use tobacco, whether you have an individual or a family plan,
Right.
and the metal tier of the plan you choose.
Metal tier.
Yeah, like bronze, silver, gold, platinum, or catastrophic.
Okay, I think I've seen those before.
Each one has different levels of coverage and cost sharing. It's also important to remember that insurance companies aren't allowed to use your gender or any pre-existing conditions to determine your premiums anymore.
Right, right. That was a big change with the ACA, I remember.
Exactly. A big win for consumers.
The book also mentions how premiums can be really different depending on where you live, what state you're in. And apparently they've basically doubled in the last 15 years.
Yeah, it's pretty alarming when you look at it that way.
It is.
That's why it's so important to shop around and compare plans carefully. And remember, when you're choosing a plan, don't just focus on the monthly premium. Look at the big picture, including your deductible, copays, and coinsurance.
Yeah, it's easy to get caught up in that monthly number. Speaking of costs, the book also mentions these premium tax credits that some people can get. What are those?
So those are subsidies that can help people afford health insurance. They're usually available to people with incomes between 100% and 400% of the federal poverty level. You can either use them to lower your monthly premiums directly or claim them when you file your taxes.
Okay, so that's something worth looking into.
Definitely, especially if you're buying insurance through the marketplace.
Right. So we talked about premiums, but there's also this whole concept of cost sharing that I don't fully get. What does that mean exactly?
So cost sharing is basically how you and your insurance company split the cost of your health care.
Okay.
Even if you have insurance, you'll likely have some out-of-pocket expenses before your insurance kicks in.
I see.
That's where things like your deductible, copays, and coinsurance come in.
Right, those terms always confuse me. Can we break those down a little bit?
Sure. So your deductible is the amount you have to pay out of pocket before your insurance starts covering anything.
So, like, let's say I have a $1,000 deductible and I need a procedure that costs $5,000.
Right.
I have to pay that first $1,000 myself.
Exactly. And then once you've met your deductible, your insurance will start covering the rest, or at least a portion of it, depending on your plan.
Right.
And it's important to remember that deductibles usually reset every year.
Oh, so you start over.
You start over.
Okay, so what about copays? What are those?
Copays are fixed amounts you pay for specific services. Like, let's say you go to the doctor and your copay is $25.
Okay,
You pay that $25 and your insurance covers the rest of the visit.
I get it.
Prescription drugs often have copays too, and you might find that brand name drugs have higher copays than generic options.
Yeah, that makes sense.
Yeah.
Okay, and coinsurance, that's the last one.
So coinsurance kicks in after you've met your deductible,
Uh-huh.
and it's basically a percentage of the cost that you share with your insurance company.
Okay.
For example, if you have an 80-20 coinsurance split, your insurance pays 80% of the bill and you pay 20%.
All right, so all of these things, the deductible, copays, and coinsurance, they contribute to your annual out-of-pocket maximum, right?
Exactly. So there's a limit to how much you have to pay out of pocket each year.
Right, that makes sense.
For 2020, that maximum was $8,200 for an individual plan and $16,400 for a family plan.
So it's like a safety net in case you have really high medical expenses in a year.
Exactly.
Okay, so the book also goes into detail about the different types of health insurance coverage, both public and private.
Right.
Can you kind of break those down for us?
Sure. So on the public side, we have programs like Medicare, which is mainly for people 55 and older or those with certain disabilities.
Oh, okay.
And Medicare is divided into different parts.
Right.
Part A covers inpatient hospital care.
Right.
Part B covers outpatient services and doctor visits, and usually has a monthly premium. Part C, or Medicare Advantage, lets you get your benefits through private insurance plans, and Part D covers prescription drugs.
Right, and then there's Medicaid, right?
Yes. Medicaid is a joint federal and state program for low-income adults, children, pregnant women, elderly adults, and people with disabilities.
So it covers a pretty broad range of people.
It does. And it's really important for covering long-term care services and a big portion of individuals with disabilities.
That's good to know. And what about CHIP, the Children's Health Insurance Program?
So CHIP is similar to Medicaid, but specifically for kids under 19, whose families make too much to qualify for Medicaid but can't afford private insurance.
Okay, that makes sense. So those are the main public options.
Right.
What about private health insurance? That's what most of us have, right?
Yeah, that's how most Americans get their coverage. At least 67% get it either through employer-sponsored group plans or by buying individual plans on the health insurance marketplace.
And those marketplace plans have to meet certain standards, right?
They do. They have to cover those 10 essential health benefits we talked about earlier.
Right, right. So employer-sponsored plans, are those generally better?
They can be more affordable since the risk is spread out over a larger group of people. The book actually gives a good example with Kaiser Permanente.
Oh, yeah. What about them?
They're a unique case. They're both an insurance company and healthcare provider with their own hospitals and doctors.
Interesting.
It's called a capitated managed care organization.
Capitated.
Basically, they get a fixed payment per member, regardless of how much care that member actually uses. And they're also an accountable care organization, or ACO, which means they focus on coordinating care and improving quality to keep costs down.
So it's kind of a more integrated approach to healthcare.
It is.
Yeah.
And it can sometimes lead to lower out-of-pocket costs and better health outcomes.
Yeah, I've heard good things about Kaiser. But there's this whole other thing that's always confusing, in-network and out-of-network providers.
Yeah, that's a big one. You definitely want to understand that.
So can we talk about that for a second?
Sure. So basically, your insurance company contracts with certain doctors and hospitals, forming a network, and they negotiate discounted rates with those providers.
Gotcha.
If you go to a doctor or hospital within that network, you'll generally pay less.
Makes sense.
But if you go out of network, it can cost you a lot more. And some plans, especially HMOs, might not cover anything at all out of network.
So you really need to check if a doctor's in your network before you go.
Exactly. Unless it's an emergency, of course.
Yeah, good point. So speaking of doctors and hospitals, the book also mentions these different ways they get paid, like capitation and fee-for-service.
Right.
What's the difference?
So we already talked about capitation with Kaiser. They get a fixed payment per patient, no matter how much care they provide.
Right.
Fee-for-service is the more traditional model, where providers get paid for each individual service. So each doctor visit, test, procedure, all that, they get a separate fee.
I see. So does one model work better than the other?
Well, it's a bit of a debate. Capitation can encourage doctors to focus on preventive care and keeping people healthy. But some people worry it could lead to undertreating patients to save money.
And fee-for-service.
That can sometimes lead to unnecessary tests and procedures because doctors are getting paid for each one.
So it's a trade-off, I guess.
It is.
The book then dives into all these different types of private insurance plans. HMOs, PPOs, EPOs, POS plans.
Yeah, it can get confusing.
It can.
So let's try to break them down simply.
Okay, let's do it.
HMOs, health maintenance organizations, usually have the lowest premiums and out-of-pocket costs, but they're also the most restrictive.
How so?
You have to choose a primary care doctor within their network, and they have to refer you to any specialist you need to see.
So you're kind of limited to their network?
Exactly. They usually don't cover anything out of network unless it's an emergency.
Gotcha. What about PPOs?
PPOs, preferred provider organizations, give you more flexibility. You can see doctors both in and out of their network, but you'll pay less if you stay in network.
Right, right.
And you usually don't need a referral to see a specialist, but they tend to have higher premiums than HMOs.
Okay, that makes sense. So what about EPOs?
EPOs, or exclusive provider organizations, are kind of a hybrid. You don't usually need a referral to see a specialist in their network, but they don't cover out-of-network care at all, except for emergencies.
So kind of like a stricter PPO.
In a way, yeah.
And what about those POS plans?
POS plans, or point-of-service plans, are also a mix of features. They're like HMOs in that you have to choose a primary care doctor and get referrals, but you can also go at a network, though it'll cost you more.
So it's about weighing the cost savings versus the flexibility you need.
Exactly.
Okay, so then the book mentions supplemental health insurance. What's that all about?
So that's basically extra insurance you can buy to cover things that your regular health insurance might not.
Like what?
The most common examples are dental and vision insurance. Dental helps with routine care, like cleanings and exams, as well as more expensive procedures. And vision covers things like eye exams, glasses, and contacts.
Right, right.
Sometimes, though, health insurance plans include those for kids under 18.
Oh, that's good to know. Are there any other types of supplemental insurance?
Yeah. There's also gap insurance, which can help with things like your deductible and coinsurance.
Yeah.
if you have a high deductible health plan,
Okay.
and critical illness insurance, which gives you a lump sum payment if you're diagnosed with a serious illness like cancer.
So those are more for specific situations.
Exactly.
Okay, now let's get into the actual benefits and costs of health insurance. The ACA requires these 10 essential health benefits to be covered. What are those?
All right, so the 10 essential benefits that all marketplace plans have to cover are ambulatory patient services or outpatient care,
Right.
emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health and substance use disorder services, which includes behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services, and chronic disease management and pediatric services, including dental and vision care for kids.
Wow, that's a lot.
It is pretty comprehensive.
But the book did mention that something like durable medical equipment isn't always included.
Right, that's an important point. So things like wheelchairs or walkers, you want to double check that your plan covers that if you need it.
Yeah, good advice.
It's always a good idea to carefully review any policy before you sign up to make sure it meets your specific needs.
Definitely. Now, what about preventive care? The book talks about how insurance usually handles that.
Yeah, so preventive care is all about staying healthy and catching problems early. And the good news is the ACA requires most plans to cover a wide range of preventive services for free.
Really?
You don't have to pay a copay, coinsurance, or even meet your deductible.
Wow, that's great. Like what kinds of things?
We're talking routine vaccinations, blood pressure screenings,
Yeah.
cholesterol checks, cancer screenings, HIV tests, depression screenings, even counseling on things like diet, exercise, and quitting smoking.
That's amazing. So it encourages people to actually take care of themselves proactively.
Exactly.
I like that. Okay, so last but not least, the book talks about prescription plans. What do we need to know about those?
So if you take prescription medication regularly, you definitely want to pay attention to the formulary.
The what?
The formulary. It's basically a list of all the drugs the plan covers, both generic and brand name.
Okay.
And formularies are usually divided into tiers, like generic, preferred brand name, non-preferred brand name, and specialty drugs.
So the lower the tier, the cheaper the drug.
Generally, yes. The lower tiers will usually have lower copays or coinsurance.
So if you take a specific medication, you need to make sure it's on the formulary and what tier it's in before you choose a plan. They also talk about these pharmacy benefit managers or PBMs. What do those do?
So PBMs are basically the middlemen between insurance companies and drug manufacturers. They negotiate prices, create formularies, and process claims.
Okay.
The idea is that they use their buying power to get lower drug costs for us. But there's been a lot of debate lately about whether they're really doing that or just profiting off the system.
Right, right.
It's a complex issue.
Okay, so we've covered a lot of ground here. It sounds like understanding health insurance is pretty complicated. But hopefully, after this deep dive, people are feeling a bit more informed.
Yeah, my hope is that they feel empowered to make better decisions about their health care.
Me too.
Yeah.
And I have to say, this book does a fantastic job of breaking it all down in a way that's easy to understand.
Yeah, it really does.
I highly encourage everyone to read Chapter 96 in its entirety. It's seriously packed with useful information.
Absolutely. It's a great resource.
So as a quick recap, what are some of the key things we learned today about health insurance?
Well, I think the biggest takeaway is that healthcare in America is expensive and is getting more so every year. That's why having good health insurance is so important for protecting yourself financially.
Absolutely.
We also learned about the medical loss ratio and how to make sure your premiums are actually going towards care. We talked about understanding your cost-sharing responsibilities, things like deductibles, copays, and coinsurance.
Right.
And we looked at all the different types of insurance plans, both public and private, and how they work.
Yep.
Plus, we talked about those 10 essential health benefits, preventive care, and prescription drug plans.
It's a lot to take in, but it's all really important stuff to know.
It is.
So I feel like this has been a super helpful deep dive into this chapter.
I agree.
And I hope everyone listening feels a bit more confident about navigating the world of health insurance now.
Me too.
But the journey doesn't stop here. We've got a lot more to explore in this book.
We do.
So make sure you join us next time as we delve into Chapter 97, Finding a Good Doctor. That's another important one.
It is. We'll see you then.
All right. Until next time, take care, everyone.
Take control of your health anytime, anywhere. Visit globalmenswellness.com and start your free trial today. Get expert-level answers in seconds, not weeks, without the cost, the wait, or the awkward conversations. Real support on your terms. Visit globalmenswellness.com now.